Great, thank you. Any suggestions for our doctors who are doing craniosacral manipulation or muscle energy techniques where the time is, say, typically around 20 minutes for a treatment?
Right. We're going to talk about phys med specifically next week, and that's where those fall into place. We'll talk specifically about your timing on your phys med, and they're billed in 15-minute increments, so you just have to kind of structure your phys med to be 15 minutes so you can bill 1 unit, or you need to get to 25 minutes so you're allowed to round up to 2 units. That's the short answer, but we'll talk about cranio and phys med next week and how to use your physical medicine CPT codes with an E&M code when it's appropriate to make sure you're getting paid for all the work you do. So I'm going to defer that to next week.
In terms of qualifying a claim for a 99205, this is the highest complexity first office or first new patient code. Would this apply to seeing a patient with moderately severe symptoms for cancer who is on chemotherapy?
I would say that probably qualifies on the complexity, the highest risk, because certainly a cancer patient, I mean, there's a risk of mortality and morbidity. So, and that's an exacerbation, side effects to medications that typically need to be monitored for toxicity, etc. So from the risk standpoint, yes. But with new patient visits, you have to meet the other criteria. So you need to make sure you get enough history. That part is easy. Make sure you check past family social history, all of those pieces. Get the physical exam in. You would qualify probably for that 99205, no problem.
Any tips for homeopaths where their style of practice doesn't really seem to fit this system?
That is a tough one. I use homeopathy, and I try to still think about this system. I mean, at least the way I was trained is a good homeopath is still, we're still doctors, and a good homeopathic intake is history, can be physical. It doesn't preclude doing physical, and it is medical decision making because we're licensed as doctors first, according to our law and our licensing with Department of Health. And this would go with any licensed state, not just Washington. I can't not run a CBC on someone who's fatigued, or if I think they may have appendicitis, I have to think like a doctor and do the homeopathy. So that's how I approach my whole patient visit, and I also get the strange, rare, and peculiars and all those other pieces I need for a homeopathic remedy. So in that way, homeopathy can fit into this system and be billed accordingly. If you do it in a different structure where you're not just doing, but you're doing a constitutional intake, no physical, not documenting in this manner, you're kind of looking more at a non-covered service waiver cash basis, or a low-level E&M visit, probably nothing more than a 214, because you're skipping components on a regular basis. So you have to, if you're doing insurance and doing classical homeopathy, you either need to structure your chart notes to kind of fit into the system. So again, someone who's not a naturopath would understand what's going on, and it's in a context they can understand, or you have to consider cash services. So there's no right or wrong answer.